Welcome back on this Monday morning. Belinda Gonzalez with NuSound Hearing and Tinnitus Center is now joining us live. Belinda, good morning.
Good morning.
Well, I hear you're finding a connection between the pandemic and hearing loss. I'm curious, what are you seeing?
We're getting more phone calls. More people realizing maybe they had a little bit more hearing loss than they thought. These darn masks cover up people's mouths and people aren't getting visual clues. And then even like with myself, we're realizing even if you don't have a hearing loss, you're getting less volume, so you misinterpret people, having to have people repeat more often. But if there was a hearing loss there before, the mask is definitely bringing that to people's forethoughts.
I can see how that could be a challenge. How common is hearing loss?
It's very common. About 63 million people within the states will have hearing loss. Many of those are doing nothing about it. Sometimes there's a little bit of denial. They feel like everybody else is mumbling. If people would just enunciate a little bit better or open their mouths or speak more clearly, because hearing loss sneaks up on us. It happens so gradually, they genuinely don't realize they have a hearing loss. So it is something that we have to do a little psychology sometimes to influence people to go and have their hearing tested.
Well, and do you find people are ever just apprehensive about getting a hearing aid? They know they need the help, but are not really wanting to go down that route of getting the hearing aid?
Yes, and that's for lots of reasons. Sometimes they've heard somebody have a bad experience with a hearing aid or with hearing aid providers, and unfortunately that happens often, far more often than I wish it would. Maybe they were working with somebody that I call more of a salesperson than somebody that's genuinely there to help you hear better. I always suggest find a place that has a doctor of audiology, like at NuSound, so that you know that you are working with somebody that's looking at this from a medical standpoint. And then find somebody that's going to do some great follow-up work, because this is not like going and having LASIK eye surgery. This takes some rehabilitation time, and you're going to need a lot of follow-up visits.
Well, how has the hearing aid technology improved over time?
Oh my goodness, I've been doing this for about 17 years now, and the sound quality and the difference it's just amazing. For example, they've had rechargeable devices where you just take the hearing aid off, put it in a charger, get up in the morning and put it on. Those have been on the market for decades, but quite frankly, they've not been very good. And now we have a device that is just spectacular. You don't have to choose between technology and convenience anymore. You can have a rechargeable device that has the best sound quality in it. There's no more pushing buttons. You don't have to adjust volume. You just put it in your ears and let it do what it needs to do. It'll adapt to your environment throughout the day depending on what environment you're in.
Well, Belinda, we are almost out of time, so tell us what's new at NuSound this month, and then how can we get more information?
New at NuSound this month, the whole month of September, if you purchase hearing aids in the top 3 levels of technology, they're actually letting you upgrade to a rechargeable at no additional cost. So that's a savings of $500, so that's pretty amazing. But you can reach NuSound anytime. You can go to our website, NuSoundHearing.com, or you can call our main office at 785-783-8121, and we'll get you set up to meet with our doctor of audiology and take great care of you.
Okay, Belinda, thanks for being with us today.